أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dear distinguished guests, respected chairs, dear colleagues, Assalamu alaikum wa rahmatullahi wa barakatuhu. It is a profound honor to stand before you today at MSLM 2026, a gathering that in itself is a living expression of the very principle I have been asked to speak about today, Waqfe Arzi. Today we are exploring Waqfe Arzi not as an abstract concept, but as a living, practical framework for addressing one of the most urgent challenges of our time, global health equity. In the next few minutes, I hope to take you on a journey from principle to practice, from intention to impact. By the sheer grace of mercy of Allah, I was blessed with the opportunity to perform Waqfe Arzi in Guatemala and Rabah, serving the underserved communities. This experience provided me with valuable first-hand experience and exposure to the challenges these populations face and deepened my understanding of their needs. Allah Ta'ala states in the Holy Quran in chapter 17, verse 71, "And we have certainly honored the children of Adam." The Quran affirms the dignity of every human being unconditionally, and yet we live in a world where the zip code or country you are born in is more powerful predictor of your health outcomes than your genetics, your effort, or your choices. For example, a child born in sub-Saharan Africa is 80 times more likely to die before the age of 5 than one born in Norway. This is not a theological contradiction, it is a human one. Allah has upheld His promise. The question this talk asks is, have we upheld ours? Access to quality healthcare remains profoundly unequal across the globe. 1.8 billion people lack access to essential health care. 1.8 billion people. This is nearly a quarter of humanity without reliable access to essential care. Low-income countries bear 90% of the global disease burden, with only 10% of healthcare resources. 90% disease burden and 10% of resources is perhaps the single most damning indictment of our current global health architecture. Note that the gap exists within wealthy nations as well. This is not just a distant problem. It is in our cities, our clinics, our emergency rooms. These are not abstract statistics. They represent real families, real communities, real preventable deaths. So what is Islam's solution to all of this? It is Waqfe Arzi, which is an Islamic tradition of voluntary service, offering one's time, skills, and expertise for the benefit of humanity. It is rooted in the Quranic principle, never shall you attain to righteousness unless you spend out of that which you love. Chapter 3, verse 93. The Arabic word waqf carries meaning of something held in perpetual dedication, a solemn pledge. Arzi refers to an offering of oneself. Together, this is a professional pledging of our most precious resource, our expertise, our time, our knowledge. It is sustained service for humanity. As this verse in the Holy Quran states, it's very powerful. And what do we love most as professionals? Our craft, our expertise, our time. This is precisely what this model asks us to give. Our beloved Hazur, Ayadahullah Ta'ala bin Nasr al-Aziz, stated in UK in 2019, addressing to the Medical Association, "It is not enough for our doctors to travel for a few days or a couple of weeks in a year. Rather, a heartfelt spirit of sacrifice is required and a genuine willingness to take time out of your lives to serve humanity." Imagine these two worlds now. World A, with specialist surplus, advanced diagnostics, abundant resources, robust health infrastructure, 10% of global disease burden. Now let's compare this to World B. Critical provider shortage, delayed and misdiagnosis, preventable deaths, crumbling health systems, 90% of global disease burden. The key insight here to drive home is this: the chasm between these two worlds is not geographic. People are not suffering because they're far away. They're suffering because of structural failures, underfunded systems, absent workforce pipelines, and misaligned resource distribution. Waqfe Arzi names this chasm and offers the response. So Waqfe Arzi actually serves as the bridge here. Now, how can we build that bridge? These are the three pillars of the Waqfe Arzi model. Number one is presence, showing up where systems have failed. There is something irreplaceable about physically being there. Not a telehealth consult, not a donated supply shipment, a person, present, accountable. Pillar two, capacity building, teaching, not just treating. The most sustainable intervention we can make is to leave the community more capable than we found it. This is similar to the office that we hold in our Jamaat. You know, what we say is that once you leave the office, leave it better than you have found it. It's very similar in this case as well. Pillar three, advocacy, changing the system themselves. This is the least visible pillar, but arguably the most powerful. Taking what you learn in the field and using it to change policy, secure funding, and hold institutions accountable. That is where individual service becomes systemic change. And I do invite the audience to consider where they themselves might fit in one of these pillars. Across disciplines, the model translates. Whether you are a physician, a scientist, a public health professional, an educator, or a researcher, you belong in this slide. The Quranic verse from chapter 5, verse 33 is one of the most powerful in all Islamic tradition on the value of human life. And whoever saves one life, it is as if he has saved all of humanity. So what makes Waqfe Arzi different is a sustained sacrifice behind it. It is not one-time act. It is orientation, a way of practicing your profession with an awareness of global need and the commitment to bridging it. Communities teach us about resilience, about resourcefulness, about what truly means to have healthcare delivery. We are there to give, but we return transformed. Medicine, nursing, public health, research, engineering, every one of you can make a difference. So what is the call to action? Everyone in this room has a skill the world needs. One takeaway to carry forward is to have an intention without action is incomplete. To remember that intention without action is incomplete, and action without intention is unsustainable. Ask yourself, where is my surplus? Where is there a need? And what is preventing me from bridging that gap? I end with this verse of the Holy Quran. Indeed, Allah will not change the condition of a people until they change what is in themselves. This is one of the most action-oriented verses in the Holy Quran. It does not comfort passivity. It calls each of us to be the agent of change in our own lives and communities. Jazakallah.